Thanks very much. So I am Simon Walsh, and I am a pharmacist with a master's in health economics, and I work for Pfizer in Ireland. So this is very much a health economics poster, and this is what we would have shown to you this year had we all been there in person. So the title of this project is basically estimating the economic burden associated with the treatment of community-acquired pneumonia in COPD patients in Ireland. So I'll just take you through it very quickly. So in Ireland, there is scant healthcare resource use costs, and we don't actually know how much an episode of CAP might cost in Ireland for a person with COPD. So that was the main premise for this project, was to understand what might be the cost for a person that is got an acute exacerbation of COPD and if they go into secondary care. So we do have some estimates in the EU. So we know that in the EU, the burden of COPD is quite large, just less than 50 billion annually. We do know that there has been Irish research with just CAP, so that was by McCarthy et al. And they did base their estimate at a cost, an episode of CAP in Ireland would be around 14,800 euros. Our research, we hoped to combine the comorbidities, so the cost of CAP with the COPD patient. And that was the premise for our research. In the US, there is an estimate of $23,000 for a person that has an episode of CAP in COPD. That is old, though, a 2012 paper. So how did we go about doing this? It was very much from a health economics side of things, so a little bit different from the last presentations. We did do a literature review, and from that literature review, we developed a treatment pathway that was based on the results of the literature review, which throughout countries like in Europe, Spain and the Netherlands, so all the data from those research articles, we combined them with local research guidance and also UK guidance from NICE. And based on the treatment pathway, we developed a model, so a cost projection model based on the treatment pathway and those outcomes. We did also do some scenario analysis, so we did look at increasing antibiotic duration and maximum healthcare resource use costs. So just to give you an idea of the pathway that we mapped, so this on the left, on the top, is basically an adult that has an acute exacerbation of COPD, and it comes back that they go to hospital. So that is the pathway through hospital and all the touch points that they may get in hospital and all the antibiotic use and healthcare resource use and consultants examinations that they might come across. And on the bottom there, you can see the healthcare resource use. So all the different items that might be costed for that whole patient flow, for the whole length of stay in hospital. So the results. It was similar to the research that was done in Ireland a few years back in 2017. The estimate that we got for one episode of CAP for a general ward admission was around 8,000 euros. And then if you apply this to someone that has to go into ICU, we estimated that this could be up to as high as 38,700 euros. So if you do add this up incrementally over 5 years, we did estimate that in Ireland, over 5 years, the cost of CAP in a patient with COPD could be as high as 32,754,000. Obviously, there is the two scenarios. So if we did extend the antibiotic use from IV to oral for a little bit longer, it did increase the results by 6 million. And also, if we assumed kind of a higher percentage of ICU usage, we did increase that estimate from 32 million, so you could add on another 23 million for higher healthcare resource use costs. So you can see how it's broken down there. This research was completed at the end of 2020. This is very much the phase 1. Phase 2 is currently in progress, where we are using Irish hospital retrospective chart data, and we will be doing a prospective bit as well. So we'll be doing patient interviews of patients in hospital with community-acquired pneumonia. So in conclusion, our research is similar to another paper that was in 2017. They estimated that it was 14,000 euros. Our estimates are around 8,000 euros. We did note that in their research, they did account a length of stay of a patient for 103 days. So that was a bit of an outlier as to why their estimates were up around the 14,000 euros. Obviously, this is a health economics type research. This is phase 1. It's only a small bit of research. And in phase 2, we hope to be back next year presenting with those phase 2, so the retrospective bit and the prospective bit, to understand if those estimates were accurate. Thank you very much for your time. Do we have any questions?